Hello, my name is Siena Lin, and today I am presenting on the role of anti-PD-1 as a treatment for cancer. I am from San Diego, California. I chose this topic because I find immunotherapy so cool, and we are able to use our own immune system to fight off cancer. So cancer treatments. There are a lot of cancer treatments. Today I will be focusing on one of the most promising and newest cancer treatments, immunotherapy. Its goal is to harness the body's own immune system to fight off cancer. Normally, cancer cells have a variety of mechanisms to avoid immune system detection. However, immunotherapy works by altering or boosting these interactions between immune cells and tumor cells. There are multiple different types of immunotherapies. Today, I will be focusing on immune checkpoint blockade, also called ICB. Here's an example of ICB. So we have PD-1, which is a receptor on the T cell, and PD-L1, which is a receptor on the tumor cell. Here in the beginning photo, they are binded, and if you look at the second photo, there's now a green triangle between them. This green triangle represents anti-PD-1, which is an ICB that I will be focusing on today. It blocking this interaction prevents the T cell from going through apoptosis. So anti-PD-1. When the PD-1 receptor on the T cell is binding to the PD-L1 receptor on the tumor cell, this causes the T cell to go through dephosphorylation, which eventually leads to apoptosis. However, when we block this interaction between the two receptors, then the T cell can not shut down and it can continue killing the tumor cells. So metastatic melanoma. This is a great example of when ICB works very well. So in a clinical trial called Keynote-001, they use bevacizumab, which is an anti-PD-1. And this leads to an estimated 5-year overall survival rate increase of 18% in all melanoma patients. And the 5-year survival rate goes all the way up to 41% in treatment-naive patients. However, 86% of patients experienced treatment-related adverse events, called TRAEs, and TRAEs have multiple grades. The higher, the more severe. 17% of patients experienced grade 3 or 4, and 8% of patients discontinued the clinical trial due to TRAEs. Glioblastoma is an example of when ICB is not an optimal option for treating it. The usual ways to treat glioblastoma, or GBM, is surgery and then chemo and radiation therapy. However, given the median 5-year overall survival rate of 4.7%, it shows that the standard of care treatments are still very, very poor. In the clinical trial, Checkmate 143, they compared an ICB, which was nivolumab, an anti-PD-1, and bevacizumab, which is a chemotherapy, and see which one was more effective. Unfortunately, they were about the same, around 10 months of median overall survival. And both treatments resulted in a 12-month overall survival of 42%. This shows that anti-PD-1 is not better than any current standard of care treatment. This is also because when immune cells enter the brain, there's a finite amount of space in the brain, right? So there's a finite amount of inflammation that can occur. So the immune cells are already suppressed when they enter the brain. In addition to this, in the setting of GBM, when immune infiltration occurs, when immune cells enter the tumor, GBM is able to change these infiltrating macrophages into tumor-associated macrophages, which creates an immune suppressive environment. And this is basically just when the immune system can't do anything to the tumor. So discussion. Immunotherapy is actually more accessible than other cancers. Other treatments. It can be cheaper and have less side effects, so more people are able to access it. Immunotherapy is not a one-size-fits-all. It's most likely be a very important part of immune checkpoint blockade will likely be an important part of the cocktail of drugs used by oncologists to treat many patients, and however, not be the only one relied on. And TRAEs, this will be a very important focus on because it dictates the quality of life of the patient, and quality of life is arguably just as important as the life expectancy. Thank you so much for listening to my presentation, and if you have any questions, please email me right here. And have a great day. Thank you.